Good afternoon and welcome to the August 17th, 2026 City Council Work Session. Brad, would you lead us in prayer, please?
Sure. Dear Lord, thank you for this beautiful, hot day that we have today. Thank you for all the people up here that are trying to do their best for the City Council, and even more so for the people that are out in the audience today, trying to help us to make the right decisions for the city. And thank you for all of your blessings that you do for us all the time, because we know it's all in your name and your grace. In Jesus Christ's name I pray. Thank you.
Amen. If you'll stand for the pledges, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible.
Texas, you went in there under you. Yeah, I'll sing about Texas.
Okay, this is a work session. Items are intended to provide opportunities for City Council to study and discuss various issues and gather and analyze information. Council will not take any formal action on matters presented at a work session, but may direct staff to place items on future agendas for formal consideration. Item 2A, receive a presentation from Alliant Insurance Services regarding the city's self-insured health plan and the projections for fiscal year 2027.
Is this good? Okay. She did. Do you want me to, is it just do the forward? All a little different? Okay, cool. Show. Let's see, is that, there we go, okay. Hi, howdy.
Howdy, sir.
Better howdy. We're in Texas. I'm doing well, I hope y'all are doing well. Hey, this is my first chance to meet you all. My name is Bob Tracy, and I'm married to Bobby Tracy. All right, we keep things that way in Texas. 47 years we've been doing that. But I'm out of the Houston, Texas area, specifically Richmond, Texas, Fort Bend County. And my role with you all is to kind of work through a renewal with Blue Cross and Blue Shield of Texas. My firm, Alliant Insurance Services, my two partners, Nick Long, who's the mayor of League City, Tim Brown, who is the lead partner in our team, and myself, we're the lead consultants based in Houston, Texas, but we travel absolutely across the great United States of America. We are strictly public sector, it's all we do. We don't do engineering firms, we don't do car washes. We develop plan designs and benefits for cities, counties, school districts. Just for a little background, one of our nearest and dearest clients is the Texas Association of Counties. We do a lot of work with them across the country developing benefits for counties. TRS Active Care, the largest public sector group in the state of Texas that provides health insurance benefits to all K-12 teachers and employees. So we have a large swath of public sector, and public sector is extremely unique in the way you purchase it through RFP work, request for proposals. The fact that you all can enter into interlocal agreements with other cities and whatnot to help get you leverage on better deals to make a group with 350 employees look like 3,500 employees sometimes. And so what our team does is we represent you all. We're not agents. We do not represent by our license the insurance industry. We represent you all. So in every instance where we represent the city of Nacogdoches, we work for you. This is your benefit plan. We do not take ownership of it. So with that said, we're glad to be here. Now we had a lot to do in a very short period of time. We came on board in pretty much the end of July. Most times a good RFP process takes 2 months, maybe 3. We spend time to develop the client, to get the data analytics right so that we know more about what we're going after. It's a very complex business that we're in to negotiate and act as your counsel. So really all we really had time to do is to improve your contract with Blue Cross and Blue Shield of Texas, which is doing a great job. They meet all elements of a great contract in the fact that they administer your program. They've got incredible networks throughout the state of Texas, here locally, as well as, again, across this great state of Texas, Blue Cross and Blue Shield. They've got great care management engines, PBMs. They're tough to beat, let's put it that way, especially in rural America. You have a lot of business in this area with Blue Cross and Blue Shield of Texas, and that means for the most part, they're going to negotiate on our behalf and get us the best deals. But that said, in a very short period of time, we didn't do a full comprehensive RFP. We had enough time to do what we consider a market check. Let's just, while we're at it, let's just see what United Healthcare is up to maybe. And really at the end of the day, Aetna and Cigna declined to even engage this process. United Healthcare kind of gave us a cheat sheet of things and we were able to look at it. But even with that said, we really don't rely on the carrier so much because we have so much data collected from Blue Cross, United Healthcare, Cigna, Aetna, the big BUCAs we call them, that we pretty much know what to expect. We do RFPs in our sleep. We are an RFP machine. There's really not many instances where we're surprised, especially at 315 employees or 350. You're basically a small, medium-sized case. So with all that said, though, along with the planning we've been doing with your departments here, with Brittany and the HR side, and we were able to just kind of take a look and felt pretty clearly that right at this time, Blue Cross is the right fit. That said, once we get through this renewal, we are going to be doing a more comprehensive RFP when we have a lot of time. We just barely got to know each other. So we did a great job bringing you the best that Blue Cross has to offer. And we're going to put this to bed and we are going to enroll it. And then we're going to start right away working with budgets, working with Mike, working with Rick, getting the budgets going, Brittany, and really go out probably Q1 for a much longer RFP process that we would look at for more of a 3 to 5 year period. So all that said, a little background. What I really wanted to do today is a couple things. First of all, on this slide right here, the second slide, I just wanted to, there's two pieces to this. One of them is what's driving our costs and how good is that? How good is Blue Cross able to deliver care management, network discounts, the things that they do well, administer the program, buy the stop loss, connect our prescription benefit managers into our medical plan, which is a whole separate piece. How are they doing? And so we benchmark them, like I said, against the market, looked at claims data. And there's two pieces to this. One of them is going to be kind of what we do, and that is to drive the cost and manage the cost side. And then obviously your folks internally with finance and whatnot to deliver the budget. And so what I'm speaking of today is really more of the expense side and what we're looking at. And one of the things that's very evident is when you get to the claims bundle, you'll see on the bottom there, you look at claims. Everything that we do is a voluminous amount of dollars, and y'all are spending $4 million, and we break it down into tracking unit costs. So in this case, per employees per month. We take an aggregate amount of population divided by the number of employees, divided by the number of months, and we come out with a cool unit cost that we can really take that and begin to really look at comparability for cost. And so the great thing that we're seeing, and the one thing I want to leave with you today, is even though we are restructuring how we budget and how we pay for health insurance, and again, that's not my job because I don't print money. My job is to try to figure out the cost of this program. Are we trending up? Do we have problems? Is this an area that's going to really cause a major restructuring in how you fund things? And I'll let the CFO deal with that issue. But today I just want to tell you this, that overall, the plan is trending flat. And that's really what you want to be at. It's not doing this, that. It's really kind of becoming kind of a flat. And you'll notice under the claims bundle there, and I'll leave this whole page at this, we're getting great administrative fee costs. The cost of administration up above is fantastic. You're not paying too much. You're not paying too little. You're right there in the middle from the standpoint of in your mid-40s for all the things we hire Blue Cross to do, like pay claims, pick up the phones, do care management, negotiate deals, negotiate contracts. We're doing that good. We got a great price in there from Blue Cross and Blue Shield. On the claim side, you see here under the current, it's 954.24. Do you see that? What that means is we take your millions of dollars of claims and we divide it by the number of employees, the number of months, and there right there is the 954.24. What we're seeing here is that, next year we had our underwriters and our actuarial people say, okay, what are you doing this year? What were you doing 2 years ago? And where is this trend line? We worry when these things begin to do this, and so many employers are facing very high escalating healthcare costs. When you look at ours under 3 periods here, the 954.24, we're projecting you to only be next year a little over that, about 1,001. Is that going to happen? We hope so, because it's a self-funded plan. You pay for your claims. But with that said, the good news is I think we're seeing a trend line that's flat, and we're going to capitalize on that next year during a full RFP process to really look at different types of programs. Do we want to bring PCPs, primary care physicians, more in play where employees need to check in as a control point with their health care? Here's what's going on with your health plan right now. We have this massive network of Blue Cross and Blue Shield. And we have hospitals all over the Nacogdoches area, all the way into Tyler, into Lufkin. People are, and we're tracking them, they're going all the way into Houston. And they can go wherever they want to go. And you know what? If I wake up and I want to self-diagnose and my heart is pounding and I feel achy, I can go straight to a cardiologist. That's how the plan works. Access for everybody. Go see who you want. Vertically, primary, specialty, everything you want, go get it. That's one of the plans. That's really the plan that we have now. It may not happen this year, but really what's becoming important in managing healthcare costs is that the control point of healthcare needs to start with your primary care physician. It just does. Finding yourself with a cardiologist and not having the background in the CBC work that's being done and getting that primary care before you then move up the vertical is proving to be a lot of chaos. In fact, I would simply tell you now that if you picked up the phone to a cardiologist at Mother Frances, East Texas Local Hospital, Nacogdoches, and you called up a cardiovascular surgeon and said, hey man, I think my heart's having trouble, I need to come see you, they go, well, have you seen a PCP yet? Why don't you start there and call us back unless it's an emergency, which is a whole nother issue. So with that said, we're going to be introducing to you some thought. May not happen this year, but it's a thought that let's offer a freedom of choice plan if you want. If for any employee say, nah, I know where I need to go and that's the way it's going to be and I want my PPO, but also offer a PCP-driven plan, which tells our employees, and by the way, we did the matches out of all the primary care physicians that your people are seeing, and there's 100 of them in this area. If we went to a Blue Cross and Blue Shield of Texas primary care control-driven plan where you need to go see your PCP and then they'll refer you up, it's almost 100% match. The doctors that are in your PPO are also, when Blue Cross comes knocking on their door, says, I want to join that network too. So it's not like out of 100 doctors that only 30 of them are the PCP plan. Almost all of them are. So the employees would simply say, oh, you mean the PCP plan where I need to see my primary care physician first is my doctor's in that one too? And this one? Well, I'll pay a little less to get in this one. I'm fine. So choices, of course, whether we get it done this year, my recommendation would be you put in 2 plans. You go with a $3,000 PPO plan like you have now, and then you say to the employees, if you want the same benefit, a $3,000 PCP plan, it'll be a little less costly. And if we do something like that, then I can work with your finance folks to come up with 2 different kinds of rates, and the employees just pick and choose. So a lot to think about. We've been under such a time crunch. Maybe the best thing to do is bring it up for consideration and then work with the team right away to begin looking at these programs, maybe do some focus groups, but my job to bring it to your attention, okay? So again, the page here is all about the fact that our plan is starting to flatline at around that 1,000 ppm, and that's going to prove good for us because that shows stable risk to the marketplace when we do that big time RFP next quarter again. This time, we just did a market check with United Healthcare. Are we paying too much, too little? They're good friends of ours. We know UHC well. They did us a favor and said, somewhere in here. So we feel good about this renewal with Blue Cross and Blue Shield. Any questions on that big page right there, anything at all. So again, the recommendation is going to be renew with Blue Cross and Blue Shield, another year with self-funded. We'll go out for a big-time RFP next year. We'd like your consideration for staff to keep considering whether we just want to offer a 3,000 PPO as the buy-up, and then the plan that the city pays 100% for. Again, choices, but on that plan, you won't have to. You'll need to check in with your PCP. And one last thing about that: if I go to my PCP and my PCP says, "Bob, you need to go get a CAC, calcium in your artery type test, go see a cardiologist," once I do that, I don't have to keep going back to the PCP. I'm now with my cardiologist. And that's great. And guess what? They're sharing records, it makes sense. Control point PCP, go to your specialist, stay with your specialist, but we'll go from there. Also, we're finding out a lot of employees aren't getting physicals. Well, if we had a plan that was PCP real friendly that says you need to check in and pick a PCP, I think that relationship would change. And I think our people would get more physicals also. That's what these kind of plans prove themselves out. So, again.
And Bob, let me throw one thing.
Yes,
so
sir.
just so y'all remember, we did add a $1,500. We have an option right now. We've only been in it for 18 months? Something like that. So and I know they're coming in kind of cold. I did ask them to dive into some silos about what our cost drivers are. And so I don't know if we necessarily want to jump in where the buy-up is or basically both options are 3,000. Our current buy-up is 1,500 deductible. But I do want y'all to look when we get into some of the details about what the cost drivers are. We do have some carrot options that we've talked about too, to try to encourage people to use the PCP or urgent care rather than some of the other alternatives. So I think Bob will hit that 2 or 3 slides ahead. And when we get them, they're going to be kind of eye-opening. And we probably do need to, and by the way, just so y'all know, our other partner entities in town, whether it's SFA, the county, even the chamber, and I'm maybe missing another one, I did reach out and say, look, probably going to call a few entities out by name because they're going to pop. And some of these drivers are atypical, and I think Bob will speak to how atypical it is as a percentage. You probably could at least attribute most of our cost increases in the last year to some specific entities that are operating here right now that may not have the best intentions. I mean, there's definitely a for-profit piece, but may not have the best intentions, that they may be literally killing the patient, in our case, our health plan.
The one that I had is different than this one?
Yes, it's a little more updated.
Oh, okay. 'Cause all my notes are based on.
I think they're in the same, I think your questions will still work just fine, because we are going to kind of move through into a couple slides and my presentation will be finished. Again, this is just simply showing you, as I said, that the red numbers are that 90.65% in the HMO Blue Essentials PCP plan match the current primary care physicians, 91%. That means that 91.22% of our PPO plans, where you go wherever you want to go, 90.65% of those are in the HMO. So they will go, oh, my doctor is in both plans. Well, this one's a little less expensive, and it's also going to be managed tighter for the city as we move forward. These are internal funding that Mike and our people are working on, so we're just going to keep going through that because that, in essence, is this is what we really kind of wanted to talk a little about today. As Todd was saying, that when we look at
You can call me Todd, but
man, I'll tell you,
I don't have.
Out here to insult this man.
No. He's like a CrossFit guy, and he has all of these stylish shirts. So if you mistake me for Todd, that's great. And hair. Hey, I'll take the compliment.
Okay. Everybody know this guy?
Yeah.
All right. I'll just kind of do this.
That's Todd.
It's,
yeah.
Whatever you want me to do.
Okay. It won't happen again. Okay. So this is something we wanted to talk about, and I'm not at all sure where we go, but that'll be what'll be. We as consultants, though, pay attention to this because it alarmed us, to be frank with you, and this is becoming a trend. If you all didn't see it, the city of San Antonio just put out a humongous piece. We're also their consultants, and they have a $40 million health plan deficit. And we got in there immediately because this is becoming a trend, and we started looking at the top providers. And what we're seeing is these corporate ER standalone emergency room companies are coming into areas. We're not exactly sure where the strategy is. I'm also not saying it's not on the up. I'm not saying that. But when we look at data, and what we're finding is these standing emergency room corporations are more costly to our health plan than hospitals. I mean, this is something we pulled out of the data. Excel ER Nacogdoches, $674,000 of paid claims. University of Texas MD, $298,000. Nacogdoches Medical Center, $137,000. It drops from there. Baylor Scott White. And again, I'm just reporting the data. We are beginning to look at these type of providers on how they're driving these type of revenue streams and cost to health plans, and we're just going to report the facts as we get to it.
So let me be the bad guy.
Yep.
Because I'm good at that. I look like Dr. Evil, so I'll just go with it. So effectively what we have, if you look at when this started, you can see that Excel ER and ProCare, but let me call out Excel by name, because they're owned by private equity, and I have no fear of private equity. Anyway, they're predatory, effectively. They wouldn't have them if they weren't just trying to make a lot of money. So you can look at that cost curve where Excel ER, even through effectively April, May of 25, then start shooting up. When you've got a cost gap where they're twice as much as the cancer care for all of our employees, think about that for a second. So what we do know is they're proactively reaching out to a lot of entities. They're waiving what should be one of your reasons to show up, a $500 ER deductible. So they're waiving that, and then because we're self-funded, we have less basically protection on the other side, and Bob can speak to that. It doesn't mean we necessarily go that way. We do need to have some discussions with staff that, hey, I know that they're not charging you anything when you walk in the door, but they're killing your health plan, and eventually you may not have the same health plan because of it. I don't want to punish the staff for what predators are doing. It's like title loan entities that are sitting on the edge of military bases. You know what I'm talking about, Blaine. You've seen them in your time. So bottom line is what we would potentially even I've suggested to staff, and I've talked about gap plans and things. It would even make more sense for us to offer up a carrot to one, brief our staff. Maybe we self-fund a small HSA for office visits for PCP and urgent cares. That would take a huge bite out of it. But they're effectively costing us, what is it, $4,500 or 40? What's the cost per
episode.
So per visit.
It's pushing somewhere around $4,000 an episode. That's almost as much as outpatient surgery.
Yeah. So at a point in here, I mean, again, did this probably help medical centers' position, just in terms of providing local care? Look at that number. They're 3 times, by U of H terms, they're 3 times the cost of a medical center in terms of impact. They're twice as much as MD Anderson. And then as we all know, to get to some of the specialists, you've got to go to UT Tyler. And the fact that they're that exponentially, I mean, exponentially more expensive than UT Tyler. Should tell you everything. It's a standalone ER on a corner near the campus. Now, if this is happening to us, what is it doing also to the student population and their families' plans? So that's why I've pushed this. I haven't sent this yet, but I said it's going to be public. We'll call it out. Apparently, there is, half a dozen local doctors that are staffed to this, and I think that there should be at least some. There's some moral ground on everything we do. It's one thing to make money. It's another thing to take advantage of the situation. And as you know, we've had a healthcare issue here locally for some time, and this is not making it better, and it won't make it better for the staff. I think they've even reached out to whole departments here, trying to catfish them in or noodle them or whatever we do.
They won't even take Medicare either. They won't take Medicare.
So again, I'll call it out because it's hitting us, but I am calling it out. I'm not going to hide behind anything on this, because if it looks like a duck, it looks like it's probably a duck in this case. So, and we are going to have a discussion following HIPAA, of course. We're not getting any details, but just this is what you're doing to your health care plan if you use these folks. So we just want that out there since y'all got the camera running. Please do.
One of the things, and we'll stop with that, this is happening all over with different corporations and corporate ER. I mean, the one in San Antonio is not XL, it's somebody else. But one of the biggest issues with this is the Affordable Care Act and whatnot formed a policy that, you need to cover ER rooms just like any other provider out there. And most of these do not contract with networks because they want to charge what they want to charge. And as Rick said, waive copays, deductibles come to us. And under the system that you may have heard at the No Surprise Billing Act that was set up by the federal government to try to stop out-of-network providers from just charging what they want. They get out of the network, therefore they're not in the Blue Cross Blue Shield pricing contracts. They're out of network, they charge what they want, and under the No Surprise Billing Act, which is self-funded plans like ours, the federal government set up this appeal process, and you negotiate back and forth. They do a terrible job. The federal government does a terrible job of negotiating with these small little providers in Nacogdoches, Texas. They do a terrible job. They do a flyby, maybe this is a good rate, whatever. That's how they do it, and that's the jurisdiction we're under. Now, the great state of Texas, however, the Texas Department of Insurance said this is BS. We got to help these employers with their health plan, and these employees who are getting copays and deductibles. Of course, we're not getting that, are we? They forego that, as you said. Make it the incentive to come see us. Under the Texas version, they come in like an insurance company, so whether you're in or you're out, here's a fair price for what you all do under procedural codes and under facility codes. This is a fair deal, so take it. But we're not under TDI, we're under this federal version. So one of the things our firm is doing, because we represent the city of San Antonio, and also Texas Department of Insurance gave this same leverage to TRS Active Care for school districts across the great state, 1,100 school districts, and ERS, the Employee Retirement System in the state. Those are also clients of ours. They said, y'all are big public entities. We're going to bring you in under the TDI, fair, reasonable rate deal. Cap the cost for out-of-network providers. It works great. We're trying to get you all, our city of San Antonio, we're going to try to get more of you in that program. And therefore, moving forward, there'll be balanced billing because they're going to get X amount and take it or leave it. Blue Cross will pay them that. If they want more, they got a balanced bill, but they can't do that. So
we're not saying they're doing anything illegal.
no, absolutely
But what we're
not.
saying is they're playing
need
the
a better
system.
deal.
They're playing the system. The system now works to their advantage, and it hurts us particularly because we're self-funded.
Yeah, no.
So we don't have that stopgap on that. So they think they're hitting Blue Cross, they're hitting us.
Yep.
And then ultimately, this won't be sustainable. But if you look at, I'd almost want to line up some of this also to maybe when Memorial probably had some of their population down too. This could be affecting our other providers here as well. just from a competitiveness sake. So it's having 2 or 3 levels of effect. But I can tell you, we can't keep doing it this way.
And here's the slide that Rick is describing. Look at what's going on. This is ER room utilization and cost to our health plan. Look at the current rolling 12 we ran. There's the 676,000. Just a year ago, it was only 121. So this is becoming a very aggressive type environment we're in everywhere, not just here, but in San Antonio, in Houston. We need to do what we need to do to protect our health plan, our taxpayers, our employees, their families, and we just want to be fair.
And it's not just the cost per visit, but look at this is where the marketing, whether it's showing up at chamber events and ribbon cuttings and all this stuff. You've seen the PR stuff for certain entities. But look at the prior rolling and the current rolling. From 63 freestanding ER visits to 163. So there's several factors. It's the volume and it's the cost, like anything else.
Okay.
Since a private person under your plan doesn't have to have any kind of money involved in all this that you're absorbing, what's their incentive?
Well, here's the thing. They're supposed to be collecting a deductible.
But they're not. So
And
what's
so-
the incentive?
So the incentive would be if we do our own self-funded mini gap plan, basically, and we try to designate it for PCP visits and urgent care for weekends. The goal is to get people back to the proper care instead of
Neutralize it.
infrequent. This would be a carrot. So even if we spent $250,000, think about what that impact would be to start getting people back on the PCP side to see their doctor during the week, because we're picking up the $45 copay, or urgent care on the weekend, $65. But this is not urgent care. That's not what this is. But we do believe there has to be, without diving completely into it, there has to be visits that otherwise would have been taken care of at a PCP or urgent care that are feeding into $4,000 visits that wouldn't necessarily have to be that.
Can you urge them just not to go?
That's, well, that we need to do a series of workshops. I think it's information plus again, part of my proposal would be to the carrot plus some education, because the flip side is if this were to continue just trend wise, our jobs here is to tell you what it is. And hey, if this isn't sustainable, then eventually, then maybe we're not even able to cover the full cost. Forget the dependents. We're not even cover the full cost of the premiums for the employees. And God knows we don't want that situation. I don't want to punish the employees because somebody got the word on the street. You can come in here and it's not going to cost you as much.
Blue Cross, we've talked to Blue Cross, this has already been upgraded to what they call their pricing integrity division. They want to know about this, so they're going to be doing it also. But here's all we're asking: join our network. XL,
Yeah.
just join our network.
Be a network.
and negotiate a price, because it's important to have these ER. I mean, they are incredibly important to somebody who's going through a moment in time. We want them to make money. We want them to be successful. It's important to your community to have companies like XL. There's nothing about it's just, why don't you join our network and let us help negotiate a fair price, and then we're good to go. We have other ER rooms. When you contract with Mother Francis, Nacogdoches Memorial, they all went as a hospital negotiate their ER rooms under their contracts. We got deals. It's these standalone corporate entities that are out here saying, no, we'd rather take our chances with the federal government and giving us what we consider our fair price. And that's fair. But join our network. How's that? Blue Cross will go across the street and go try to sign a deal with them. So let's hope they can work with us in partnership, and we'll go from there. So again,
And we are putting it on the legislative agenda as well. We'll go carrot, stick, we'll use stick too, on both the state and the federal to try to wall this off as well. Close that loophole.
can't wait to, the more the merrier. The next one is just simply, as we talked about, and this is one other thing. We want to help our retirees. They work hard. They put in a long career with the city. One of the things that we'll be doing next year is working with them in meetings and talk about what they want to see. There is an administrative code in Texas called Chapter 175. It's set up in Texas. It's a law. It's not a bill. It's a law that states we have to offer retiree benefits. And we want to offer retiree benefits. But this time around, as your consultants, there's a lot of other really good choices for both the employees who are retiring. Some of them don't want to stay here. They want to go somewhere. So we're going to work on this. We must still do this, and we want to still do this. Your GASB 73, 75 auditors are beginning to show that your retiree liability, you don't have to fund it with cash, but it's growing. So let's get ready for the future. You want the workforce, they want to know if they retire here that they're going to get some help. Again, it's a situation of let's try to do it better and more effectively, and that's kind of consulting firm Nick and Tim and I are for you. So TML has great solutions, so we'll be working with a lot of folks at the RFP as we move forward. Just a couple other things. We always look for cost drivers, and this is just, and by the way, there is nothing in here about personal health information. We could put this in the newspaper. This is just numbers data, and we're allowed to do this. First of all, you as a stewards of a self-funded health plan, we as an employer, we can look at this data, try to manage. So you can see here that generally speaking, 5% of your membership, we have about 600 members, men, women, and children, and 5% of those are going to do 60% of the cost. Those are the folks that are hard driving, big time stuff, hospital admissions, specialty pharmacy. So this is not unusual to see this. You have about 35 folks, but you can see the trend here. This is what does concern us as consultants. Just as we talked about on the ER room situation, the corporate standalone emergency room problem going across this great state and really across the country. This is also a trend we're seeing in every one of our health plans. The increase, we went from 22 of these high-cost claimants to now we're at 35. That's 10% of our group, and those 10% are easily moving towards half of our claim costs. This is not unusual, but it's an area we've got to really figure out how to buy specialty drugs. Blue Cross is a good helper in that. So as we enter this full RFP next year, early in the quarter of 2027, we're going to be looking at ways to kind of begin to look at this. So it's, again, a growing issue that impacts a small amount, but it ultimately impacts a large amount because of our healthcare rates keep going in that direction. Again, they're trending flat now, but with the ER room deal, with this type of news, and we're looking at the PBM, we have more folks on expensive specialty drugs, away we go. So all that said, hey, here's the big show here for tomorrow. We did seek we had a very short period of time. Brittany kicked some tail getting this thing ready to go to market. We knew it was just not going to be enough time to make big changes, but we did check and we went out, but we're going to recommend, again, Blue Cross and Blue Shield be renewed. The city paid group life AD&D is going to be recommended to go with a company called Symetra. They are a lower cost, better benefits for our employees. So that'll be on the agenda. That's all we need to do for tomorrow is renew with Blue Cross. And even if you said, let's just renew with Blue Cross and y'all decide whether you want a dual choice, PCP, whatever, we just need to get the contract renewed. We'll deal with the details. Same thing with that. Just go with Symetra. We'll get it all done. And then we're going to put in a bunch of new voluntary benefits for our employees. And it's going to be great. We're going to have enrollers out here. We're going to be telling everybody about our great benefits, which we have here at the city of Nacogdoches. We have a strong package. So we're going to keep working on the budget with the folks here, and away we go. And we pretty much covered this. Those are the big ticket items. We pretty much hit all those, and we are ready to go. And I'll see you tomorrow. Okay. All right.
Thank you, Todd.
That's it.
All right. Thank you, Todd.
John?
And I guess the only other thing, do y'all have any other questions? I realize that's a lot through the funnel. And by the way, again, let's see. We've literally had, and they've done the deep dive. Alliant has done the deep dive with our data and had to pull pretty good amount. You haven't even had it for 2 weeks. So this is not something we could have brought sooner. But after the initial look, again, we asked them to dive into the high-cost drivers, and they're not ones that should be cost drivers. We should not have these increases. And so I just want y'all to take that into account and want to be great if the media will also follow suit, of course, because, again, it will kill our health plan as self-funded. And then if at some point we went to fully funded, you know, you don't have as much control over that over time, too. You know, we get bad years and rebid. Next thing you know, it's going to cost us more. So that might, you know, that's why we're also going to go out, take the legislative approach, some carrots, some sticks, and everything we can do to stop this. But this has been something that honestly should have been flagged sooner, should have been made known to us sooner once the trend started. But this is where we are. That's also why we brought a line on. I'll leave it at that.
So because this PowerPoint has changed, it's kind of hard for me to keep up with some of this, but we had it's sort of a rainy day account, right?
Well, that's our self-funded. That is our plan. That's how we pay for it. So
But is it lower than it was last year now?
it is now. Now we had the other thing was we had a historic high 24, 25. Is that correct? And then this happened. So
we've dipped into that, or
we will dip into it.
by
Yes.
how much? $1 million?
Correct. However, again,
Are
if we
gonna
could,
make up that million for the next year?
so we have proposed, obviously not putting on the employees, we've proposed raising our contribution and further the taxes that were owed from the settlement with the prior operator, the Lion Star, dropping that into the fund of about, our net would be about 375,000. So put that into the fund, go up a little bit on our, not all the way up to the 950, but I think to 725 to 850 per employee, and then also do a hard dive about trying to cut this impact off from both legislative side, carrot, and in education. Hit it basically 3 prongs. And I know they're not going to like it because somebody's either got a Lambo or an Aston Martin or a daughter that goes to college at SMU and a BMW. It's not our problem. My problem is to stop this. So that's why
Did you say Lion Star?
Yes.
Are they gonna pay
Correct.
for something?
It's the ad valorem taxes that they owe.
the judgment from the bankruptcy identified that they have to pay
The
that.
district will pay it. They were assigned through the bankruptcy court they were liable for the property taxes, and I guess they're paying it. They've got plenty of money now.
That's good to know.
Our understanding is that it may come either end of this month, hopefully.
Yes.
But again, this had to be also affecting Memorial in the same time frame at probably their lowest point. It had to be hurting them too.
I'd like to just thank the city, the departments, Brittany and Rick and the entire staff on everything that they've done in such a short time. I think prior to this, I don't know if we'd ever even looked at this. It was years and years and years. And it is what it is this year. And like the gentleman said, you know, you'll do a RFP or Q or whatever it is in first quarter of next year. And it'll probably be a lot cheaper going forward. Isn't that what you said? I know.
We'll make sure you get the best deal.
I know.
Wait, you just said claims keep going up and you pointed down.
Anyway, thank you very much for all you've done. This is very much. Thank you.
Absolutely.
Any other questions? No questions. Okay. All right. Okay, item 2.B, receive a presentation from Enterprise Fleet Management regarding a city fleet vehicle management solution for the projections of fiscal year 2027 and beyond.
Thank you, Mayor and Council. Todd Semino, Interim Finance Director. So we're going to talk about fleet management next. And just to give you guys an idea, our current fleet management system right now is not very centralized nor uniform. So we're looking at ways to basically centralize that and make it more uniform. Currently, each year, each department director is responsible to tell us what new vehicles they're going to need, and they also tell us which vehicles are going to be disposed of each year. And so it's very hard, and it's very hard to predict those cash flows going forward from year to year. So we've been working with Enterprise Fleet Management System for several months. We've told y'all workshops coming in to explain it all. And what we envision this partnership with them is they're going to help us manage our system. They're going to help us basically with the acquisition and the lease of the vehicles, the management of those vehicles, and most importantly, in my opinion, the disposition of those vehicles. So it will make those cash flows a lot more predictable for us so we can budget better. But I also think it's going to bring some savings, and it's also going to make our system of rolling fleet vehicles more effective and more efficient. So with that said, I'd like to ask Jennifer Bertram to come up. She's the Senior Account Executive for Enterprise Fleet Management, and she will walk you through the presentation.
Mayor, Council, thank you all for your time today. There we go. All right. So I'm going to walk you through kind of from a 30,000 foot view. What does this look like? If we were working with City of Nacogdoches, what is Enterprise going to do? How are we going to help? And what is the financial impact? And at the end of this conversation, I'm going to walk you through a cash flow model that projects out over the next 10 years based on our recommendations and how that's going to impact both your capital and your operating budget. You might notice the Enterprise sign there in the middle. If you've ever rented a car from us, that's our parent company. We own and operate the largest fleet in the world, which is insane because we've grown from 7 Cadillacs in the 60s to almost, I think 1.9, almost 2 million vehicles that we own and operate now. In our division alone, we manage 800,000 light and medium duty vehicles, including emergency response units, to exclude, for now, ambulances, and we don't do fire trucks. So anything essentially that's under that kind of 33,000 GVWR threshold, like so a dump truck or below. So we're going to talk about each of these areas today. I'm going to give you a kind of a highlight of what you're doing today, what we're recommending. Specifically, I want to start with acquisition and point out that from a buying power perspective, the City of Nacogdoches buying power is based on end user. So that just means that no matter whether we go through the state contract, buy board, we go directly to the factory, it's all based on Nacogdoches fleet codes. So that part would stay the same regardless of whether we were working with you or you're buying from a dealership. All that buying power is based on your buying power. So that part's the same. We'll talk a little bit about the upfit on some of these vehicles, logistically, how we can help remove some of the administrative burden that some of the departments are feeling, having to work with the different upfitters. We're going to talk about funding specifically as it relates to cash flow, as Todd had mentioned. How do we have a more predictable budget year over year so we're not seeing these giant peaks and valleys, which also then impacts our operating costs as we run vehicles too long. We'll talk a little bit about specifically fuel and maintenance. Today, the city is maintaining the fleet in-house. I don't think the plan is going to change, but we do have some options down the road that we could backfill or supplement if we needed to help there. But more specifically related to the expense, what the expense looks like today, why we're recommending to replace vehicles at a certain point, and what that's going to do to operating costs. And we're going to ad nauseum talk about resale today. Resale is the most important component in your total cost of ownership. And I think most cities are doing a pretty good job trying to get the bids on the back end process and get the best deal they can from a resale perspective. But when we're selling vehicles on average every 13 years, they're not worth as much. And it is Enterprise's biggest competitive advantage. I'm going to talk a little bit about that and how City of Nacogdoches can actually leverage some of our infrastructure that's going to help you guys from that perspective too. So here's some folks that we are currently working with. We work with more than 250 government entities in Texas alone. If I couldn't fit them all on one screen. Some other folks kind of in the East Texas area that y'all probably know. We do work with Nacogdoches ISD already. They partnered with us about a year ago. City of Palestine, Marshall, Longview, White House, Gladewater, Mountain Vernon are a couple of those that come to mind. It's really interesting because most of our clients, they're very different from the perspective when they were managing their fleet prior to working with us. They all had different philosophies. Some had an internal VERF already established where They knew they were replacing vehicles on a cadence of 5 to 10 years or whatever their established policy was. Some had nothing built into the general fund where it was really, this is what we have this year, what can we replace? But it's interesting when you look at the commonalities between all the cities that we work with, everyone's trying to do more with less. Everyone's trying to cut back. How do we cut costs? And the fleet actually is an opportunity to lower your total spend. That's a screenshot on the right-hand side there from the state page. Cities, counties, universities, and school districts on average run their vehicles for around 9 years or longer. And the thought process generally is, well, we do low mileage, right? We, you know, on average, we see kind of across the state, usually non-emergency response vehicles are averaging somewhere around 7,500 miles a year, where our ERVs, or emergency response units, due to just the nature of how they're being run, are doing a little bit higher mileage. But either way, we're paying cash for the asset. The thought process is, well, let's run it as long as we can to get our useful life out of it, right? And that's really common. And then again, from a commonality standpoint, usually multiple departments have multiple budgets and plans. An example of that, maybe the police department has 4 or 5 units every year that they're requesting based on the fact that those vehicles probably need to be replaced more frequently, where maybe code enforcement gets the hand-me-down truck, right? Each department kind of has different plans, but it's usually because the capital budget is dictating the replacement schedule. So here's what we have this year. Here's what you get to replace, right? Versus the opposite of that is determining the lowest cost of ownership to replace the asset before it starts costing us more and aligning our capital budget with that. This is just a kind of a ballpark macro view, big picture. When you look at the total cost of operating, both capital and operating costs, usually I think most folks are thinking, well, the capital spend must be the biggest piece of the pie, right? Because it's the biggest check you stroke at one time when you buy the vehicle. But it's interesting because usually operating costs represents more like 60 to 70 of your total spend, fuel being a really big bucket there, right? What happens in a year where we are going to cut back, the first thing we typically see cities do is cut capital spend. We got to cut back somewhere. So this year, instead of replacing, 10 vehicles or 12 vehicles, we're only going to replace 5. Because we need to use those funds towards a different priority. But what happens when we do that is then the overall total budget goes up, right? Because the overall average age of the fleet goes up. The only way to lower both pieces of the pie is to lower the average age of the fleet. So let me show you an example here. This is a Chevy Silverado 2024 that could be bought on the state contract that year for $38,000. So y'all are already doing a great job of this. Procurement is doing a great job making sure we get a good deal on the front end, that we're not overpaying for vehicles, right? But what we're not looking at is what are the vehicles worth if we sold them at the right time. We pulled third-party data, and this is Manheim. You're probably familiar with this pretty large auction. This is a sample size of 2022s that were sold at auction. Average odometer was 15,000. Average sales price for those units was 35,000. Just because you paid, so essentially these are 2-year-old vehicles you would have run. You bought it for 38, you would have sold it back into the market after 2 years for around 35,000. Now, just because you paid 38,000 for it doesn't mean that the end user in the used car market has any clue what you paid for it, right? You guys have government buying power that's below market value, right? They are just paying what the market dictates those vehicles are worth. So essentially, you would have run that vehicle, turned around and sold it back for almost what you bought it for. I'm not saying every vehicle in the fleet is going to be turned over every 2 years. We want to make sure that we're stretching the depreciation the appropriate amount of time. And there's a couple factors there, right? It's what does the aftermarket cost look like? We want to make sure we stretch that out, and then we're in a good equity position. But there absolutely, over the last 10, 15 years, we've had many cities where we've been able to flip those units even faster than what we had originally anticipated because of what the market has done. So it's something that we're going to continue to evaluate year over year. Again, not saying every vehicle is going to get replaced every 2 years, but looking at the market and what these vehicles are worth are significant to your total cost of ownership and recouping that equity back into your budget. So essentially, this is what we help our clients determine. Yes, we take a little bit of a depreciation hit when we drive that vehicle off the lot, that first year, right? You got your depreciation gap closes a little bit because you guys have government incentives, which brings down that capitalized cost compared to retail and even fleet, which are 2 other markets in the auto industry. With that said, I think most folks, they're running vehicles kind of towards the end of its useful life, where we know that maintenance and fuel go up a little bit on an older vehicle. But by and large, the most important component in your total cost of ownership is the resale value if you had gotten rid of it at the right time. It's that orange line right in the middle of the circle. I would be pointing at it. I don't know if this thing has a laser. But so that's significant. Selling those vehicles back into the market at the right time to the right buyer, which we're going to talk about, is what makes this plan sustainable long-term for the city, right? And by default, we're going to lower maintenance and fuel, right? If we're running a fleet that's significantly newer than our average life cycle today, around 13 years, most of that is going to be routine maintenance. We have, let's just say, an average age of the fleet, 5 years or younger. We're talking oil changes, maybe some tires for PD, but most of that stuff's under warranty too. So we're going to significantly decrease our maintenance spend. And then benefit is that technology on new vehicles comes out. Now we're not replacing vehicles every 13 years, we're replacing vehicles every 4 or 5 years. And we're able to take advantage of a potential hybrid engine on an SUV that we don't need, a diesel truck, right? We can right size the fleet as well as we identify the replacements every single year, which gives us an opportunity to tighten each year as well. Any questions on this part? So we have to figure out, okay, if the math makes sense and we know we need to replace an asset at X point before it starts costing us more, how do we sustain that long-term with the budget? Well, you could continue to pay cash. So these are ballpark numbers for the sake of this example, but 200 vehicles, if you replace them every 5 years, you'd be replacing 40 a year. If the average capitalized cost of the vehicle was $50,000, then you would need to build in $2 million this year, but then next year and the next year and the next year and next year to sustain that plan long term if you're going to continue to pay cash. I do have 2 cities that do that, but I will say they have a VERF that's very well funded and they're in a very affluent area. But I only have 2 cities in the entire state of Texas that still do this because they know it makes sense to replace the assets at the right time. They just cash fund it because they have the ability to do so. 99% of our clients all use some other kind of funding source because they know they can stretch the cash flow in order to sustain this without having to pull funds from other priorities. So the other option would be financing, right? You could finance these vehicles. Everybody's familiar with financing their own vehicle, home, what have you. That's better from a cash flow standpoint. So 10 grand per unit or 400,000 that we would need to build in from a principal portion this year. But what most of our clients are using is the market value finance because it allows us to just fund the portion of the vehicle we're using and conserve even more cash flow. So let me show you a better example of this. I told myself to take the transition out of this thing. So traditional finance, you are essentially, if it's a $50,000 vehicle, you're paying it off to zero. Whenever you sell the asset, let's say it's worth $20,000, you get your equity back at the end. So in a traditional finance, you're essentially putting 20 grand in the glove box and driving around for 4 or 5 years or however long you finance it, right? And then you get your equity back at the end, which is okay. I mean, it's better from a cash flow standpoint, but you are still tying up capital in a depreciating asset. The market value finance, also called an open-end lease, is not a closed-end lease. So most folks, when they hear lease, cringe, right? It's like, mileage penalties. That's a closed-end lease. Like if you were to go to a dealership, they would say, well, you have 12,000 miles a year, and if you go over, I'm going to get you on a per mile. And if you ding it up, I'm going to ding you. We know these PD units gets used pretty hard, right? That type of lease we do not recommend, and not just because of the mileage penalties and wear and tear penalties, but because you don't benefit from the resale. And that's the most important component in your total cost of ownership. The open-end lease tastes, feels, and smells exactly like a finance. The only difference is how much we're financing to conserve cash flow. The reason it's a lease is because the mechanism, especially for our commercial clients, can treat it as a capitalized asset or an operating expense, but with all the GASB, FASB changes, everybody basically treats them as a capital lease anyways. So in this same example, if we know the vehicle is going to sell at the end of that 5th year and it's worth $20,000, why don't we just finance it down to 10? So essentially we're only financing the $40,000 we're using over the time. When it sells for 20, whatever, and again, that 10 grand is essentially your payoff or it's a residual RBV. It's all the same thing. I don't know why it has to have so many names, but it's just what's owed at the end. When it sells for 20, that 10 grand in equity is yours. So we can cut you a check back for it, or the city can choose to roll it into the next vehicle, kind of keep it in the fleet as an internal replacement fund in its own. But the city has the option. No mileage penalties, no wear and tear penalties. You can sell the asset at any time. If something happened and we just needed to get rid of the vehicle, we could get rid of it. It's just the difference of what's on the books for and what it's owed. One other difference is traditional finance are front loaded with interest, right? Where you pay all that principal, I'm never going to pay off my house towards the end, right? But the open-end lease or market value finance is a flat line principal or depreciation. So you're paying the same amount of principal every single month. It actually puts you in an equity position faster and keeps you there. So you don't go upside down halfway through the term because you're not paying enough principal. So we will look at the structure of those based on application. I've already done this with staff, but provide recommendations. We'll be more conservative with emergency response units. We'll probably pay a little bit more principal on theirs than we would have to on a code truck. It doesn't have as much aftermarket. Any questions on this? So this essentially is the tool in the tool belt that allows us to sustain a replacement plan long term. We talked about if we're replacing assets at the right time, we're recouping that equity, we're selling them when they're worth a significant amount more. By default, we're reducing maintenance and fuel costs because we're replacing vehicles sooner. And again, the equity is the most important piece. But it's not a one-time recommendation where next year you guys will go back to the drawing table and go, good luck next year. We're going to be working with you year over year. So we're going to implement an account team, likely maybe even the similar team that works with the district. And our job is to help you guys analyze the cost every year, look at the market, and provide those recommendations. So I'm part of the team. I'll be on the account for the life of the account. My job is to do all the front end analysis, provide those recommendations, look at how that's going to impact capital and operating spend. And then I work hand in hand with the client strategy manager to onboard the account, get the orders placed, and then look at the spend with him behind the scenes. But he's going to be meeting with you several times a year. Annual client review is a year over year look. Think of it as like the meeting you have with your financial planner, going through each category that we're managing. Where do we perform? Where do we want to tweak? What do we want to do going forward? And then your fleet planning meetings, very important because we would meet with staff in the beginning really of your budget process. So February or March, when they start having those conversations, work with the different departments to understand what the needs are for replacement. We had conversations leading up to today of what needs to be replaced with what is the application, how much are we towing, do we need a vehicle that big, is there any aftermarket we could swap over? So those are all conversations that we've had up to this point. And there's been many situations where maybe we could do a compact truck because we didn't need a full-size truck, we're not towing. And so that gives us an opportunity to right type the fleet in those applications, but we're doing that annually. And as new models come out, we're comparing all the makes and models for all of our other cities as well. We can show you without a doubt, not just acquisition costs, but operating costs and resale, what's the lowest cost of ownership in each category. And so that allows us to be really nimble year over year, make good decisions that we haven't factored in those future savings, right? Future decisions as it relates to right typing and right sizing. But it is something we will do year over year. And then not to get too granular, but you'll have an account coordinator. You're not calling a 1-800 number in another country to get help. Staff will be supported by a team that knows the account, that's designated for the account. So, and then we have a whole logistics team. Our whole local leadership team over Northeast Texas is also local. So they'll be checking in for sure with staff throughout the first year. And then, not to bore you with the details, but as you can imagine, Enterprise has an entire acquisitions team for every state, and a separate license and title team, all of those things. National Service Department, if we needed to get involved as well and help if there was a major issue on a vehicle or a lemon or something like that, we could assist with the city. Sorry, did you have a question?
No.
Oh, okay.
Not yet.
Okay, I just saw you doing the thing. So, okay. So we talked about selling the asset at the right time, why that's significant, but selling it to the right buyer equally is important. We realized a long time ago that selling vehicles at auction probably didn't yield the highest rate of return. And so Enterprise created our internal remarketing division. All they do is hand sell vehicles. So we have, as you can imagine, boots on the ground in every market, working with the franchise dealers, the note lots, the independent wholesalers. I was actually in our Houston office in 2014 and 15 when oil went down. So you can imagine all of our oil and gas clients that were just flooding the market with white pickup trucks. So we shipped our clients' trucks up to Kansas City, which netted us, it cost a little bit to transport them up there, but it netted the clients more money because we know what's going on in the market in specific places too. So we can always move them if we needed. And if it made sense and we needed to hold the asset a little bit longer, we have that flexibility too. So, hey, it was slated to be replaced in that 5th year. The market's taken a little bit of a turn. It's going to be more cost effective. We'll price it in 6. We'll look at it in year 6 and 7 and see what makes the most sense financially. But so 15% of the time we do use auction. We run our own lanes. So the buyers come to us. We have 2 lanes at all the major auctions and all the major markets. And in that case, a 1999 pickup truck that we're selling that's, that old, it doesn't really matter where you take it, but it's going to make a big difference when we start selling the vehicles as they get the newer ones, especially the leased ones when we turn them over on the second round. And so 85% of the time we do go back direct to dealer. Our ability to sell vehicles against the baseline, which is commercial value index or black book, is over 10%. In our market, Houston and also Dallas, we're selling closer to like 14-15% over CVI. So what that equates to is on a $20,000 truck, you're looking at $2,000, $2,500 back to the city above and beyond, going to auction or what that value index is. And that is likely due to the culture in the remarketing team as well. So these are young guys and girls. Everybody, including myself, has to work in the store when you get out of college. And then from there, you get recruited in different departments. So all of these guys and gals are on a performance report trying to sell vehicles, including the enterprise rent car ones, but all of our clients too, for more than their peer, because that's how they get promoted internally. And so the culture's there to drive that. So and all of those results we get to present to you guys at your client review and show you, hey, here's what we were able to sell above and beyond. It's actually really incredible what they do. And so we'll handle the process. We will deliver the new vehicle first so the city isn't down a unit. And generally they need a little time to get stuff out of it or tools or whatever. And then we'll come back and pick up the old asset and then hand sell those vehicles individually. Any questions on that part? One question I get very often is, well, why couldn't we just do this on our own, right? We could find some kind of funding source, right, to fund these vehicles. Hands down, our ability to look at the market, make recommendations on when to sell, because we're selling 1 million vehicles a year with the largest reseller of vehicles in the world, that is our biggest competitive advantage. I would say our recommendations are an analysis, hands-on approach to looking at specific units, what needs to be replaced with what, our aftermarket team, all of those things, but our ability to resell assets, hands down. This is just another example. We even do sell, I didn't mention this before, but some of the units through our retail car sales division. So we're truly looking at all the avenues and what's going to make the most sense. Client dashboard that comes with the partnership. So whatever we're managing or whatever spend we're managing, that it's going to feed in. And the screenshot at the very bottom, that's our proprietary software. It's called the Toolkit. It allows me to build one F-150 with XYZ specs on it and then tell it to compare all like vehicles. So that was the tool I was saying. We can look at it year over year in each category and provide those recommendations.
The delivery time the same or less than just privately buying them like we do now?
Yeah, so what we've discussed with staff so far is doing a hybrid approach. We can use any dealer anywhere. Our RFP through the TIPS Cooperative and Sourcewell covers everything fleet management, which is the procurement of vehicles, the funding, maintenance, fuel, resale, all those things. Most of the time it makes more sense to go directly to the factory. So we could build the Chevy 1500 with whatever specs the city needs on it and tell the factory to build it, then they'll drop ship it into a local dealer.
So what's the lead time on that?
It depends on what the lead time is for factory ordering. It's relative to whatever every other dealer is experiencing though. So directly through the factory, I mean, somewhere between 12 and 14 weeks for some makes models. The Tahoes take a little bit longer, but the great news is that we have the ability, like we have some really aged vehicles in the PD fleet. So we were talking about sourcing maybe some of those a little bit quicker. We can get them to upfit and then do a second round of factory orders now that finally this is the first year that Tahoes have open ordering again. So we could factory order some of the Tahoes and have those come in a second phase, like closer to springtime, and then they would go to upfit so that they're not absorbing all of those units and like right at the same time.
Dan's going to correct me, but I think we have some Tahoes that are older than some of our cadets.
5 years old. So, what does the police think about this? Dan or Bill, you want to give an opinion?
Dan and I've spent a lot of time going through all the stuff.
We have.
Yeah.
Thank you. I'm Dan Taravella, Assistant Chief of Administration. I'll be honest, initially we were opposed to it. I'm not a financial guy, so I left that to Todd in finance. As long as the finance department is confident and feels comfortable with this end she's talking about with the finance, as long as we get our vehicles when we need them, we're good with it. I've explained that our concern is any downtime, which she has addressed that. That they would provide the replacement vehicle first before they took our old one.
Yeah.
That's a big deal. That if they take a F-150 four-wheel drive, that they give us an F-150 four-wheel drive or a like vehicle.
What was your opposition to it originally? Just fairness on you?
Well, I'll be honest. It comes down to finances, and I don't understand on the level they do. I was not a finance major. So again, like I said, if finance is very comfortable with this model, we're fine with it. We just need our vehicles when we need them. We need the equipment we've always had. We can't shortchange our outfitting. The officers need what they have in their vehicles to do their job, just like fire and public works. If they have certain equipment, they need that equipment. We've been assured that's not going to be an issue, so we're comfortable with it.
Well, I know that I had a policeman that lived across the street from me, and that was a great comfort level. Do they get to take these vehicles home, or is it a big pool of vehicles and they have to run over and put their kit in
No,
there?
currently we have a take-home car policy in our department, and as many departments do. We have enough vehicles to do that right now, even though now we are fully staffed. I think we're one position short right now, maybe two. So we have enough vehicles right now to accommodate our take-home car policy. So if you live in the city or the county, you have a take-home car issued to you. That makes these cars last so much longer. They look better. They're better maintained. The officers put their own skin in the game. They'll take care of these cars. You'll see them more in the community because they're
Makes the
parked.
neighborhood
Yeah,
better.
you see them in your neighborhoods.
So you'll get to do that with a leased car also?
Yes, because what vehicle she takes from me, she's gonna give me another one.
Okay.
So we're gonna continue that plan as long as we can, and we don't see anything changing the way it's been explained to us, other than we're gonna have a whole lot newer cars, and we might get a couple cars a week. We might get 20 in a week. However the market allows, but as long as we get what we need and aren't down cars or shortchanged cars, we're good.
And is there a choice of brands or anything like that?
Yeah, so Enterprise doesn't dictate any of those decisions. The cities make the decision. We just provide the options, the recommendations, and y'all have full control. So we've got Tahoes for the patrol units, and then we looked at a combination of potentially SUVs, and we looked at some trucks as well for CID and admin, but they have complete control over that. And we don't tell them where to go get upfit. They're still going to use their same supplier. For PD specifically, Enterprise doesn't get in the middle with the upfitter. We deliver the vehicle, PD's very particular. They want to talk to the upfitter, make sure all that communication stays consistent and the same, and so we just let them handle that part and get the vehicle to them. We'll work with more logistically on like public works and some of those, but specifically we try to step out with the police department and fire, just let them handle that part.
Do you buy from local dealers?
We can. Yeah, we absolutely.
If
we could,
they chose to do
yeah,
that.
if staff and council decided that we wanted to do that, we absolutely could. We're just here. Think of us as the broker. We're just looking at all of the different avenues. If the factory or if it's the local dealer, we can do any of it.
The bottom line's gonna be the money, though.
Yeah, let's do it. Yeah.
Okay.
Sorry. This is the best part.
Yeah.
Okay, so what we're looking at here is a 5-year replacement plan with the second 5 years, so years 6 through 10, looking at replacing those assets again. So these are 2 life cycles, okay? I'm gonna start at the top left-hand quarter and walk you guys through the assumptions, and then I'll work through the numbers on the bottom. So currently, in the light duty fleet, so this is anything that's 1 ton and smaller, we have 163 vehicles. So I should have mentioned earlier, but when it comes to medium duty, like a dump truck, we're going to look at those on an exception basis. We're likely going to run a dump truck for longer than we're going to run a half-ton truck. So we will look at those on an exception basis. It doesn't mean the enterprise can't help with those, fund those, maintain those, all of those we can. But again, this model specifically is looking at 1 ton and smaller. So based on your average purchase history, your historical history, you're replacing vehicles every 13.3 years. Basically just means if you keep purchasing at the same rate, it's going to take you 13 years to turn over the entire fleet. Today, you are currently maintaining this segment of the fleet around $285 per vehicle per month. This is only accounting for labor cost for 1.5 mechanics, and you have 4 mechanics. So we did take into account that from a labor perspective, they're working on other equipment and mowers and all sorts of other things. So this is only taking into account labor for 1.5 mechanics, which we felt like was very conservative. And I worked with staff to pull out some of the medium duty and heavy duty equipment in there as well to make sure we had a good conservative number. You are averaging 12 miles per gallon today on the fleet, which we know is being brought down by the police fleet, as we have a lot of idle time there. So those likely are doing less than 12 miles per gallon, but we do have some lighter units that are doing a little bit more. You're averaging 9,100 miles per year. And then for the assumption, we use 325 as the average capitalized cost. That's just really relative, has to be the constant that feeds all the way through. And then, so we're proposing, there was 3 units, I think all 3 of them were in the airport that we designated could just go away if the fleet was newer. We didn't need them. So the proposed fleet size going forward would be 160 units. I will say, I think once we dig in a little bit further in future years, there may be other assets that we determine if the whole fleet's new, and because it's so old now, that maybe there are a handful others that could go away if the whole fleet was new. But right now, it's going to take us some time to get to that point because we kind of have to catch our tail. So we're behind in terms of the 13-year life cycle. We are proposing a 5-year life cycle instead of the 13. And then we are anticipating for your maintenance on new vehicles going forward to be around $108 per vehicle per month, and new fuel economy averaging at 16 miles per gallon. We know that that is conservative based on the fact that we have options for hybrid engines that we've looked at, miles per gallon on the new trucks. So we feel very confident that 4 miles per gallon delta is conservative compared to what the results we're going to see. Any questions on those assumptions? Okay. The orange or yellow line, depending on how my glasses are reading today. Mustard, yes. We really should make it brighter. Is representing your average year. So today you have 163 units. You are replacing 12 a year based on your 13-year life cycle. You own all 163, which puts your capital budget at right around $729,000. And you have some aftermarket for those 12 units. A big chunk of that's the PD units. But all the departments have aftermarket. Some lights, and they have to have all the safety stuff too. Your maintenance today, based on budget numbers that were provided to us, at $557 and fuel at $701. You do have some equity coming back at the end of those 13 years, but the vehicles are just not worth as much being that old. And then we do have quite a few high mileage units in the fleet today too. And then on average, so I'm going to pause real quick as we're talking about the PD tech equipment. So there's been quite a few changes to, and Chief can speak to this better than I can. I'm going to try not to botch this, Chief. But changes to the compatibility with radars, radios, and cameras based on some technology updates that have happened. And so over time, the police department is going to have to replace that equipment anyways because they don't talk to each other. So the thought process so far has been they don't want to put brand new equipment in an old vehicle. So they've been doing it slowly as they get new vehicles, but we're going to have to fast track that a little bit as we get new vehicles. So we are accounting for that spend, but we're not anticipating having to buy all of that equipment again in the second life cycle. That equipment usually can get swapped over, once or maybe even twice, depending on the technology. So on average, that $85,000 is just representing the 4 vehicles a year that in patrol that they're having to swap that equipment out in. So all in capital and operating costs, an average year, you're spending right around 2.1, almost 2.2 million. Any questions on that part? Okay. So I mentioned having to catch our tail a little bit. This strategy in year one is a twofold strategy to try to impact the operating costs in the first year while also leveraging as much equity as we can. So if we're replacing the oldest assets that are costing us the most in maintenance and fuel, we're going to take a big decrease in maintenance and fuel costs while simultaneously replacing some of the assets that are right at that optimum time of replacement that are worth more. They have more equity. So that's helping to offset our capital budget. So in the first year, we are recommending to replace 82 vehicles. Those are not all going to arrive in the same day or week or month. Even if I ask the factory to build them and deliver them, even within a cadence, it just doesn't happen that way. With all the upfit times are going to be different. We'll be tracking that. But throughout the first year, staggered, we're going to replace 82 units. The lease payment or that market value finance right around $1 million, and then you have some aftermarket for those units, and that's separate from the PD Tech equipment. We're talking about the light bars, cages, all that stuff that they have to put in it anyways, and Public Works, the grill guards and some of that stuff that has, most importantly, the safety lights for Public Works and parks and stuff. Maintenance, we're going to see a dip from 557 to 313 in that first year, again, largely due to the fact they're replacing 82 of the units that are our biggest, worst offenders and getting them out of the fleet. Fuel, we're going to see dip from 701 to 416 or 466, sorry. And you have $620,000 in equity within those 82 units. So that's the equity for your owned fleet today that we can cut you a check back for, or you could choose to roll it into that lease payment and lower future years, like a down payment. And then we have PD Tech equipment. There was 40 or so units that needed new radars, radios, and cameras, and that's the 524. So the first year we're essentially right around cost neutral. Now, what I will say is that this is accounting for 12 months worth of payments because the way this model, it just annualizes, right? But with that said, how vehicles are going to deliver and stagger throughout the year, you're only paying for them once they land. So I have worked with finance to help project conservatively, so we have a buffer, but is the units we know longer upfit, you're probably only going to be paying 6 months worth of payments, right? And then there's some that maybe they'll deliver a little bit sooner. You'll have nine months worth of payments or what have you. So I've helped account for that in true budget numbers, but accounting for all in annualized costs, we're right around cost neutral that first year. Any questions on that? Okay. In year two, we replace 43. So you see our payment increases as we add more vehicles and subsequently have aftermarket for those units. And then we replace 18, then 9, and then 8. And then at the end of that fifth year, we're fully integrated. We've cycled all the fleet into our program, and we're sustaining a 5-year life cycle. So as the payment goes up, we see the aftermarket coordinating to the quantity of units that we have. Maintenance starts to flatline out, as you can see as we move into that fifth year, and same thing for fuel. Now, this is where it gets interesting. At the end of the fifth year in 2031, we're replacing the 82 all over again. And we have 1.8 million in equity coming back that year. That's the equity above payoff. So if you remember my example, we're financing the $50,000 truck down to 10. We still had to satisfy the 10,000, right? The payoff, what was owed, and then we sold it for 20. That 1.8 million is what we're going to receive above and beyond that. That just goes to show how much these vehicles are worth if we sell them at the right time, especially because of the low mileage, right? That is the sustainability overall. It's when we get on the life cycle, because remember the first 2 or 3 years, we're really selling some old stuff, and we have high mileage stuff over 100,000 miles. So just not worth as much. But once we start selling these on the right cadence, and we keep doing that year over year, we're going to sustain this plan long term. Operating costs should start to level out. And I know this shows a savings, but I would encourage you to just look at this from a cost neutral position. If it costs the city the exact same as what you're doing today, essentially, but the city has newer vehicles, just think the safety piece of it, right? Our officers have the best, safest features, and new technology comes out all the time in terms of safety, right? We're lowering our maintenance and fuel. Hopefully you're decreasing some downtime if we've got old trucks that are in the shop. What does it do to staff, right? To have safer, newer fleet, right? But again, if it costs the same, now we do know it's a savings. We feel like this is conservative. We're going to be meeting with you guys annually, providing the results, but this is, it's a very successful program for 250 government entities across Texas.
So did you take this model and conflate it with inflation and different changes and chaos that comes in 10 years? I don't know anything.
No,
How
but
do you guys know that?
well, we don't have a crystal ball. We have to have a starting point, right?
But I mean, what did you base it on, the last 10 years?
We
or-
base it on historical purchase history for your baseline today, right? What we can't do is base all the future 10 years on stacked inflation that we don't know. We don't have a crystal ball. And we also don't want to go back 10 years ago when vehicles were $24,000 either. We have to look at where do we start? We do have to draw a line in the sand. But with that said, we know things shift. And that's why when we're meeting with you.
So did you build that in at all or not?
No, you can't build inflation into, because you can't build it into your current line.
Well, I mean, in our medical insurance, we built in a worst case scenario and the normal security.
This is worst case
Well,
scenario.
I mean, theoretically, you could, it'd be, but I would say this, you'd also probably be building in with that inflation, that would also even carry over into your other areas, including your
Resale and stuff.
resale value.
Yeah, I mean,
So
when-
it
as the-
might
yeah.
net out if you were to add it, because it's gonna go on both sides of the ledger. Now, can you plan for, you know, Iran war, Russia, China,
I
whatever?
knew I was gonna spark you on this.
Set me off in motion, but
It was a
you can't,
softball pitch.
you can't plan for the COVID,
Right.
you know, scenario of inflation or kind of what we're now seeing on CPI. Over time, those aren't the norms, but it's gonna happen, and I think it would probably, again, it would probably flatten out over time.
And we will be here to help do the analysis and
And it's
determine if we need to run it longer, for example. We have all of that flexibility as
And
well.
it's an open-end lease. If we don't like it, we can just.
Just keep running
away.
it. You just keep running it, right? You just go back to running it for 10 years.
Let me ask Todd. Todd, are you satisfied with these numbers? The real Todd. Yeah, the real Todd.
Yeah, I am, and I will mention also, just throwing it out there, I was against this program in Beaumont when we did it over 10 years ago because I don't like paying interest. But in Beaumont, we had enough money to cash flow these. And even though we had enough money to cash flow them, we decided to go ahead and go with this because of the savings. Like she said, newer vehicles, they're safer vehicles. You're going to decrease your maintenance because everything's going to be pretty much under warranty. You're going to decrease your fuel spending. But the biggest piece, like she said, is the equity that they can get that we can't.
Right.
When we bring a vehicle to an auction, we're lucky if we get $3,000 for it.
Right.
And so they're the specialist at determining when to get into the market to get our equity back. And so Beaumont's been through 2 of these cycles now, 2 of those 5-year cycles. It's working for them. I've double checked all these numbers. I'm satisfied with it.
That's what I wanted to hear.
Right.
Thank you.
Yeah. You can keep talking, but I think you've done pretty good.
Him?
No, you.
Oh, thank you. Todd just closed it out for us. Okay, are there any other questions?
No, there it is right there, $771,000.
Okay. Well, thank you very much for your time. I appreciate it.
I didn't mean to cut you off.
No, I mean, that's a good way to end it. I
Did you have a
appreciate
big finish you need to do? or anything?
it. No, I don't think it was
We'll bring her
literally
back to do the whole budget next year if that helps. Move it faster.
Compared, yes,
Todd,
yes,
did you
I
have
agree.
So just so you know, we do plan on bringing an action item to the first meeting in September for it.
Thank you, lady, very
Thank you
much.
for your time.
Uh-huh. Okay. All right. Next item, item 2C, receive a presentation on the city's hotel occupancy tax fund and projections for fiscal year 2027.
Mayor, Council, Jessica Sal, Community Services Director.
Hi, Ashley Morgan, Visit Nacogdoches CVB.
So we're going to tag team this presentation a little bit for you. I promise we have a lot less numbers than our predecessors on both these items. So today we're going to go over our hotel occupancy tax fund, how we currently get this money, what we have in the city banks for that, and then how we spend it, and get some feedback from y'all on if you like the direction we're going, if there's any other projects you would like us to pursue or look at. So we'll do kind of a big bird's eye view at this. So hotel occupancy tax funds are funds that the city recoups from local hoteliers, and those funds may only be used to promote tourism and promote the hotel and convention industries. You can see on your screen, currently the city brings in a little over $1 million each year since 2023. Those first 3 years with 2020 through 2022, that is COVID and kind of the bounce back from that. But consistently over the last several years, we've been bringing in a little over $1 million. Once the city brings in that million, we currently split it essentially 4 different ways. 72.5% of that goes to the CVB and Ashley staff. That is her entire budget. And of course, their department does such a great job promoting Nacogdoches, bringing tourists here, getting these conventions here, and supporting our hotels. Then the other $95,000 is allocated to the Expo Center to support some of the items they do and some of the conventions they do and the fair and things like that. $25,000 is allocated to our Historic Restoration Grant Fund each year. That is administered by your Historic Landmark Preservation Committee, given out to property owners in any of our 5 historic districts to support the visual cohesiveness and the historic nature of those districts, which then again promotes tourism, because we do have a lot of people that drive through those districts and view those beautiful houses. Anything remaining after those 3 pie pieces are essentially taken away is used currently for historic sites maintenance. Our historic sites department submits budget requests each year saying, you know, we have these 3 projects and we'd like to use HOT funds for that. Because our historic sites are one of our main tourism drivers in town, we can use those HOT funds for it. So those unallocated funds, ooh, that's very tiny. Sorry about that. It should also be in your packet. But I just want to give you all a snapshot of essentially what we've asked for out of those HOT funds from the historic sites department, out of those remaining or unallocated funds. So since 2023 up to currently what we have in progress, we've spent about $486,000 over the last couple years. Some of those items are very big ticket items, which are not necessarily an annual thing, like we replaced the Stern Huya roof, the Durst Taylor roof. So some of those we're going to replace once, and then we won't have to, hopefully, again for many, many years. We've also done things like our Zion Hill exhibits are in progress right now. And I will say over the past couple years, we've also done exhibits for the Nacogdoches Railroad Depot and our Durst Taylor Museum. So we use those HOT funds to do items like this at our historic sites, and it gives our general fund a little bit of relief. Because since HOT funds can be used for this, we don't have to ask for this money out of the general fund in order to maintain our 4 city-run historic sites. And so those are some of the things we've done in the past couple years. And I will mention that not every piece of museum maintenance is funded through HOT funds. It just depends on how much we bring in that year, what is available. So the general fund still does fund some of these maintenance projects, but not all of them. Ashley,
So one of the things that we've talked about with council and with Rick is potentially using some of these hotel occupancy funds for events that have a direct impact on tourism. It should be noted that this would be for overtime costs, so this hotel occupancy cannot fund like general governmental expenses, but any overtime caused for maybe like the police department could potentially be used by hotel occupancy tax. And so I put together a couple of events that would qualify based on a threshold of over 60% hotel occupancy the night of the event, because our average is 50 to 55%, so anything over 60% shows an increase, and several of these events come in actually at far higher than 60%, but the events that we believe could potentially qualify are the Old Town Rig Down, Blueberry Festival, Wine Swirl, SFA Homecoming, and the Christmas Parade is a little bit on the cusp of that 60% threshold, and part of that might be this past year. We had a really large Christmas parade with the Clydesdale horses, and it can also be a little bit difficult to attribute that all to the parade because that was also an SFA graduation weekend. So basically you can see it's divided by colors. So like the dark red is 2025 for Wine Swirl, the lighter red is 2026. The data is a little bit wonky because I only have data from August 2024 forward. So I can't go back to 2024 for Wine Swirl and Blueberry Festival because they were prior to August, and then I can't go forward into 2026 because some of those events haven't happened yet. But I just wanted to give you kind of a view of how different years can affect these events. But as you can see, all of them come over the 60% threshold, except for Christmas Parade in 2024, which was also a weird year because we had to cancel due to weather and move it to, I believe it was December 15th, which was a Thursday. We did not see an increase in hotel occupancy that day, probably because it was a Thursday. It's just not really one of our most common tourism days. But yeah, so here's our general occupancy. As you can see, SFA Homecoming actually took the lead for the highest occupancy. I believe it was 88% last year in October. So I know that the Homecoming Parade probably doesn't seem like a huge tourism event, but the numbers don't lie. And then we did have 88% occupancy in the hotels the evening of the Homecoming Parade and Bonfire. And then, as you can see, Wine Swirl, Blueberry Festival, and Old Town Rigdown were also strong contenders.
So I mentioned that every year Historic Sites submits requests to use those HOP funds. This year I just wanted to give you all a snapshot, which is also in your total budget that you have seen, or we'll have look at more tomorrow as well. But some of the items that these are the items that we've requested this year out of HOP funds. One of them is updating our design guidelines, and this would be a grant match. We hope to apply for a certified local government grant, which would fund half of this project. So overall, it's about a $55,000 project. These design guidelines are used very heavily by our Historic Landmark Preservation Committee. The current set we have is from 1991, so it's a little older. It does have some guidance in there that isn't really used anymore, and there's also some preservation techniques and materials that aren't talked about at all that are very common now. So we do hope to update those design guidelines, so maybe they'll last another 40 or so years. And so our HLPC has a good document to lean on. We are also requesting to add one part-time Historic Site staff member. That will allow us to open our Railroad Depot on Wednesdays to match our other 3 sites. It would also allow us to open 2 of the historic sites on Sundays. I know that's been a big topic lately, and our staff is happy to open on Sundays with that additional support. Also adding 1 person would allow us to essentially rotate our weekend schedule, so not every single staff member has to work every single Saturday and Sunday. So we think that would help with some of our staff retention, get some of our museums open, and then make some of our hours more consistent.
Okay, let me ask you something.
Yes, sir.
Tell me what you really think about opening on Sunday.
You want to take that?
Let me jump in
Because
there.
I'm gonna tell you something. I'm in retail, and I'll tell you right now, it's a loser. And you know, if you're gonna stay open on Sunday for 2 people, that won't cash flow.
So, go ahead.
I was just going to say that what I suggested was that we look at also kind of cross-promoting, since SFA has their museum open and then we have limited hours too, that we at least try this. I've also said let's start doing some classic movies. They haven't even gotten into that part yet, because last time I chose movies, I go way back, 50s colorized things, or black and white. So try to do several things to kind of pull everybody back towards downtown. Now, I do think it'll be interesting to see what happens this year with SFA. If some of our businesses, let's just pick on Aromas because they were in there, if they not only open back up on Mondays, if it makes sense for them, and then, you know, we do want to have more to do. Now, if it doesn't just flat out work, I think we'll come back and tell you. But this is also why we're trying to do the downtown theater, event center, you know, concert venue analysis, downtown hotel. We do need more stuff to do for people. And it's a chicken and egg. And it may be that this is premature. Now, it's not a huge amount of money.
There you go. It's
That's one of the reasons we suggested it this way. We wouldn't suggest it was $100,000. I'd say, maybe not yet. But if it doesn't work, it's not the end of the world to pull back from.
And I'll agree with that. And I just, you know, the concept down here is a whole different ball game compared to, you know, a couple of historic
Correct.
sites. But like you said, we don't have a whole lot invested. But still, if it doesn't work, I want us to have be able to
It- I-
say,
and I-
look, let's pull this thing back because those employees could be at home, you know, with their families, you
And
know.
I will say, as far as the employees, I think even if, you know, our historic sites does a great job of keeping track of who comes, what time, so we do have those benchmarks where we can check, you know, in 6 months or a year if no one's coming, and of course, we'll advertise it and try to get as many people in the door as possible. Even if it doesn't work, having another part-time person for historic sites would be incredibly beneficial.
Right.
There have been times in the past couple of years where I go work at the Railroad Depot because we have a staff member that's sick and a college student that is out of town for some reason.
Yeah.
So I think having that staff would very much benefit the historic sites department.
I'll just give you an example in retail. This town is not big enough to be open like on Memorial Day, Labor Day. We tried it. It's not big enough. And what it was a free-for-all for your employees to sit down there and do nothing. You know, they got paid time and a half, you know, and it didn't make sense. And until this city grows in population, i.e. people coming here from other states or from other cities across Texas, for the university, from the medical standpoint, whatever, we have to have population, you know, and we have to have tourists. So I just want us to be cognizant of the fact it's not a whole lot of money, but let's just watch it, and if it doesn't even move the needle on anything,
Yeah, and
get rid of it.
and
you know?
we're, again, I mentioned this in our presentation on the event venue. That hotel study and that event venue analysis will really kind of test the waters on what the latent demand is, where we could bring, but it's going to take more to move that needle.
Right.
It's going to take some other major attractors
Absolutely.
to get people here in a meaningful way, other than just a spur of the moment, short day trip from wherever to wherever. Because again, you're going to need several things to be, and again, you don't want to become Fredericksburg. I don't think anybody that was from Fredericksburg would want to be Fredericksburg. You can ask all the people that families were from there. You want to have a nice, steady, good amount in town that doesn't change your town where you're no longer feel like you're where you grew up. So, but we need to do better. We have gaps. We have parts of the year where we're way too low, and then we can bring it up closer to a constant.
And I'm not gonna belabor this, but like you've got things on the horizon too, like the Stone Fork is gonna probably come back downtown. I mean, is it gonna happen tomorrow? No. But is it gonna happen? Yes, it is. You know, so that'll be another attraction that we'll have. So anyway, I'll quit.
I do want to mention that if I had my pick, yes, I would love for every historic site to be open on Sunday, just because currently we do have visitors coming. They're not coming in on a Sunday, but Sunday is the day that they're typically leaving. They're looking for one or two last things to do, and it is difficult for us. And the visitor center is the only thing that's open. Unfortunately, volunteers are not a reliable source, and so you're right. You have to pay them if you want them to show up on a Sunday, because we're in East Texas. Sundays are not a day that most people want to work. That's their one day. And that's our culture. That makes sense. But it's hard to justify it right now. I think you're right in the sense that we need to wait until our population is a little bit bigger before we really look into funding maybe all historic sites open on Sunday or something like that. And going back to what I said at the last workshop, I personally think a bigger investment would be earlier in the week, Tuesdays, because we have quite a few people coming in on Mondays. I know that's surprising, but one of our biggest audiences is retirees, and I always joke that time is a construct to them. They don't have to abide by a Monday through Friday schedule like people like myself do, and people in my age group. We travel on a strict leave on Friday, get back on Sunday situation. So I'm not trying to do anything on Sundays, and most of the time I'm like, okay, let's leave early enough so I get home so I can have time to do laundry and rest. But I understand that for retirees, that's not their schedule. They can come in and go anytime they want. But yeah, I think that having options on Sunday would be amazing for us, and so that's why I'm supportive of this current proposal. But I don't think we need to try to throw everything at it right now. I think we need to test the waters a little bit.
Thank you.
Is there any possibility we could put a little energy toward hiring part-timers that are senior citizens that don't necessarily need money but would like the thought of being paid for 5 hours on a Sunday or a Monday or Tuesday or whenever you want.
That's me and you,
'cause-
Brett.
Well, and I'm just trying to get us some work.
Are you looking for a job?
But-
No, I'm just kidding.
But actually, I'm thinking, you know, because you mentioned, oh, we can't get a student to come or the whatever. Well, maybe there's some other people that don't want a full-time job but would like some purpose in life.
Yeah.
So you might think about that.
There was
if
a
you haven't.
volunteer program kind of geared with that in mind a few years ago. I don't think it paid, but it was called Give Five, and it seemed like it had some good energy behind it, but unfortunately the volunteers that came out of that didn't last long term.
There's a difference between volunteer and paid.
Absolutely, for
You
sure.
know?
Yeah.
And if they know they're gonna get a little extra,
Yeah.
20 hours a week or something. It's just a thought.
Yeah.
And now, I thought that Stern Huya's roof came before the council a couple of years ago, that we paid for it.
Yes, it did.
Was it same funds that it came out of?
Yes, those came out of the hotel occupancy tax fund.
Oh, okay.
It
Okay,
still
I
runs
was
with the
just
normal
like
city
it's-
budget, so you all, if it's over a certain dollar amount, still have to approve those contracts. So yes, sir, it did come
Oh,
out.
okay, cool.
And one other note on that part-time staff, that is, the schedule we're looking at is a 1 to 4 p.m. on Sunday, so that still does allow staff with some family time to go to church if they so choose, and still be able to be open a few hours on Sundays. And a few of the other items we have on here are the Stern Huya pest exclusion. It's really a steel barrier that goes under the Stern Huya Museum. You will not be able to see it from the street. It's been approved by Texas Historic Commission. Will help us keep some of our local varmints, like raccoons, out from under the house, which cause more pests and things like that we've been dealing with this past year. And also some irrigation repairs. The irrigation was put in roughly in the 90s. Tree roots have grown through it. Irrigation's basically shot at this point. So adding those. So those are the typical types of requests that we put in to use hot funds for museum maintenance each year. We as a staff and from other communities have talked about some other potential uses for hot funds. Some of these items are items that we've done in the past that we may look at reusing, or some of the current ones we do. Some of them are like visitor center and historic sites improvements, which is typically what we use these unallocated hot funds for. Updating some wayfinding signage. If y'all notice all those, where it's supposed to be purple signs, the pinkish purple signs around town, those are paid for by some of our predecessors at the CVB for wayfinding signage throughout town to help our tourists. So maybe an update of those. Also some event support and grant reimbursements. There are some CVBs and some chambers in other cities that give essentially event support grants that are done on a reimbursement basis. Like if you say this was a couple years ago and Old Town Rigdown wanted to come for the very first time, maybe we could have, if they got a certain dollar amount invested, or if they brought a certain hotel occupancy, we may have been able to give them some of their money back. So there's a possibility to implement something like that here in town. Also updating those design guidelines and possibly doing some sports tourism. I will say with each of these things, our finance department and our city attorney needs to look at before we implement any new programs, because some of this is all done on Texas law. And so sports tourism sometimes is very heavily bracketed, that you can do some things, but you have to be within this many square miles, believe it or not, of a certain lake in Texas. I'm sure they have very good lobbyists when they made all of these things. So if we wanted to implement any of these, if it was the council's desire that, we want y'all to go full-fledged into sports tourism, we would talk with our city attorney and with finance to see how we could do that. And we are happy to answer any questions you may have about this, or if there's any direction you'd like to give staff of items you'd like us to see pursue for hot funds.
Ashley,
Yes.
how much money do you have in the bank?
We
Never
do-
mind. I'm just kidding.
Okay, I will say, and I've been warning Randy about this, but just so everybody knows, the visitor center has 6 AC units, and they were all put in about 30 years ago. And one of them got replaced last year, but we still have 5 more that need to be replaced, and we're anticipating pretty heavy number for that. And I don't know if y'all remember, but a few years ago there was this little uncertainty between the city and the CVB, so we weren't sure if that was going to come out of our budget or if that would come out of the city's leftover hotel occupancy fund. Also, since that time, hotel occupancy is climbing. We are each year told we are going to have a higher budget than last year, which is a great problem to have, and it's also difficult when our other departments are being told that they need to cut back, So things are going well hotel occupancy wise, and so I just wanted y'all to be aware that that expense is coming up, and so yes, that is why we do have quite a bit of money set away. We didn't know how much that's going to cost, and if we would have the city's assistance for that. But things are looking better now.
I'm just kidding.
I know.
Anyway.
What about the elevator? Somebody got stuck there?
No, that didn't actually happen. So the fire department showed up and they came in and they said, "Hey, we're here to get someone out of your elevator." And we were like, "There's nobody in our elevator." So it was the ghost. Just, we might need to, get some exorcism going or something. I'm just-
And the other thing we didn't talk a whole lot about on the overtime, so that's street crews, parks, and PD and fire, and those that are involved with our events. Instead of that hitting the general fund, we do need to start spending where we're eligible for that. And you got to remember, of course, you got Blueberry and some of those others. So that's a way that we can tap some funds. It's not going to kill our general fund moving forward, and also not necessarily stick all of it to some of our partners like them in Rig Down, which, they contribute a lot, but those costs have escalated too. Now, as we're also becoming more fully staffed in PD, instead of it becoming like overtime, then it's just OT. So it'll be, I think we can manage our way through and hopefully not burn through everything between OT and air conditioners.
Yeah.
Okay, thank y'all very much. Any other questions? Okay. All right, that concludes our workshop. We had lots of numbers, lots of information. Thank you all very much, and I appreciate the staff on what they did and the presentation that they gave today. Thank you very much. Y'all have a great evening.